my name is Brenda and I'm going to be your nurse today. Can we start off by you telling me what your name is?
Janelle Sanchez.
Okay, do you know where you're at this evening?
Yes, Florida Hospital.
Okay, and how old are you?
I'm 24.
Okay, so what I'm going to be doing today is going to be a thorough, full head-to-toe assessment just to review and examine your body systems. So the patient up to this point seems to be alert and oriented ×3. She appears to be her age, which is 24. Her skin looks unblemished and uniform. She is nutritionally balanced. She also, when she walked into the room, she had a straight posture. No assistive devices were used. She had a steady gait and full range of motion of her extremities. She has an appropriate affect. Her speech is appropriate. She's an English-speaking patient with a normal, steady pattern of speech. Her hearing is intact bilaterally in her ears, and she appears to be well-groomed and cleaned and maintained. So what I'm going to do now is I'm going to assess generally your head and your face and take a look at that. So please let me know if you experience any pain throughout this assessment. So what I'm going to do first is I'm going to check your scalp. Do you feel any pain?
No.
Okay. Her scalp looks like there is no discoloration, looks healthy, normal turgor, and hair is evenly distributed on her head. So what I'm going to ask you now is if you can mimic what I do with my face. Raise your eyebrows, close your eyes, open your eyes. Okay, can you stick out your tongue for me? Can you do it side to side? Okay, so what I'm going to do now is I'm going to check your sinuses. So tell me if you experience any pain. Does that hurt?
No.
Here, that hurt?
Mm-mm.
So no tenderness is noted on her sinuses. I'm going to ask you to open your jaw, close. Okay, it's checking her TMJ, checking her mastoid and her tracheas. Also, her face looks symmetrical, and her eyes as well, and she did not complain of any pain in any of the areas. At this point of the assessment, I'm going to assess her eyes. So I'm going to take a look, and her eyes look symmetrical and no inflammation noted. Now I'm going to palpate her border. Do you feel any tenderness?
No.
Okay, so her border was palpable, no tenderness was noted. Her conjunctiva and sclera are white and moist. Now what I'm going to do is feel her lacrimal gland. Please tell me if you feel any discomfort. No. Okay, so no discomfort was noted, no tenderness or protrusion as well. So now what I'm going to do is assess your extraocular movement. So what I'm going to do is ask you to follow my hand. Okay, next side. Seems like she has good extraocular movement and it's symmetrical. Her lateral vision also seems intact. So now what I'm going to do is ask you to cover one eye and cover the next one. Her eyes look symmetrical. Now what I'm going to do is check your pupillary response. Okay. Her pupillary response looks intact and it is equal bilaterally. She has good eye placement as well. Now what I'm going to do is feel her temporal arteries. Any tenderness?
Mm-mm.
So no tenderness or bulging is noted. So now what I'm going to do, I'm going to move to the other side. And I'm going to ask you to look straight ahead and let me know when you see my hands. Okay. Okay, just checking for her peripheral vision, and it looks intact also. And at this point, what we would also do is check and take her outside to go do the Snellen chart and check her vision. What I'm going to do now is assess her near vision. So what I'm going to ask her to do is take a look at this pamphlet and to read the first sentence on that pamphlet.
Florida Hospital.
Okay, now can you cover one eye and read it again?
Florida Hospital.
Can you cover the next eye and read it again?
Florida Hospital.
Okay. So her near vision also seems intact and in good position. So now what I'm going to do is dim the lights, and we are going to assess the red light reflex. I'm just going to ask you to look straight ahead for me. It is noted that her red reflex is present and there is no bulging or now we're going to move on to her ears. So now I'm going to assess her ear by pulling her peanut back and looking at her canal. Some serum noted, but overall it looks clean. Now her tympanic membrane looks intact, translucent, and grayish. No redness or bulging noted. Now I'm going to move down to her nose. I'm going to assess her nose. It looks clean, no redness, it looks symmetrical as well. And now what I'm going to do is assess cranial nerve number 1 by asking you to close your eyes and plug one of your nostrils. I'm going to have her smell something here. Can you tell me what that smells like?
It smells like alcohol.
Okay. And what about the other nostril? Can you plug that one? What does that smell like?
It smells the same.
Okay. So she has an intact cranial nerve 1 because indeed I had hand sanitizer, which is an alcohol based. Now I'm going to move on to assess her mouth. So now what I'm going to do is ask you to open your mouth for me. Okay. Tongue looks red and moist, as well as her hard and soft palate, red and moist. So now what I'm going to do is assess cranial nerve 12. So I'm going to ask you to stick out your tongue. If you can move it side to side. Perfect. So cranial nerve 12 is intact. And now since we're here also, I'm going to assess cranial nerve 7. So what I'm going to ask her to do is close her eyes, and I'm going to have her taste some 2 mystery flavors. So if you can open your mouth for me, stick out your tongue. Okay, what does that taste like?
Sugar.
Yes. Okay, now if you can stick out your tongue one more time, I'm going to make you taste something else. Okay, what does that taste like?
Pepper.
Perfect. So she got both of them correct, which means that she has cranial nerve 7 intact. Now we're going to move on to the part of the assessment in assessing cranial nerves. Previously, we have already assessed cranial nerve 1, which is the olfactory nerve, cranial nerve 2, which happens to be the optic nerve, cranial nerve 3, which is ocular motor, cranial nerve 4, trochlear, and now we're going to assess cranial nerve 5, which is trigeminal. So I'm going to ask her to close your eyes and tell me if you feel this. Okay. How did that feel?
Soft.
Okay, and it should have been soft because I used gauze. That was cranial nerve 5. Cranial nerve 6, abducens, was also previously assessed, as well as cranial nerve 7, which is facial. We are actually going to assess that one. So I'm going to ask you to raise your eyebrows. Close your eyes really tight as you can. Okay, open your eyes. Can you smile? So she has some symmetry, and cranial nerve 7 is intact. Cranial nerve 8, which is vestibulocochlear, I'm going to ask her to close her eyes, and I'm going to ask you to tell me which side of the ear do you hear my fingers rubbing.
Right.
Left. Okay, so that cranial nerve is also intact. Hypoglossal, or glossopharyngeal, cranial nerve 9 was also previously assessed. Cranial nerve 10 is the vagus nerve, and we have also been assessing that throughout the assessment by her speech, and that is also intact. So now cranial nerve 11, which is the accessory nerve, I'm going to ask you to lift your shoulders up for me. Okay. Do that again. Okay, good. Cranial nerve 12 is the hypoglossal. So that has also been previously assessed. Now I'm going to move on to assess her lymph nodes. Let me know if you have any tenderness. Okay. Now moving on to her supraclavicular lymph nodes. No tenderness there. Okay. Now I'm also going to assess her thyroid and palpate it. Any tenderness there? Okay, and I'm going to assess it from back here. Any tenderness?
No.
Okay. While I'm here, I'm also going to assess her carotid artery on one side, the other side. She has a strong pulse, and now I'm just going to take a listen to it. She has strong carotid pulses bilateral. So now we're moving on to the upper extremities. So what I'm going to do is just take a look at your arms, make sure there's no blemishes noted. No blemishes. Other arm. Your skin looks intact. Okay, so now I'm going to borrow one of your arms, and I'm going to check her radial pulse. She has a good, strong radial pulse. Now I'm going to check her brachial pulse. She has a good, strong brachial pulse. Now I'm going to check her capillary refills. She has good capillary refills, less than 2 seconds. Okay, now I'm going to check her grip strength. So I'm going to ask you to squeeze my fingers. She has good bilateral grip strength. I'm going to ask you to put your hands up. Don't let me push against you. So she has really good upper extremity. So now what I'm going to do is test for a Fallon's test. So I'm going to ask you to put your hands up and put your palms together as such. What we do is we wait a full minute to check if she experiences any numbness, tingling, sensation. Are you feeling any of those right now?
No.
Okay. So you can stop. So she is not experiencing any of that. So she does not have any problems with sensations or in her hands. Now what I'm going to do is perform the Allen's test. So I'm going to ask for one of your hands. I'm going to occlude both radial and ulnar arteries and ask you to put your hand in a fist. Gonna keep it like that for a few seconds. Now I'm going to release her ulnar artery. Ask you to open your hand. Release the radial. And she is regaining her color back on her hand. It's getting more flushed and pink. So she has a good Allen's test. Now what I'm going to do is check for sensation and for her to be able to distinguish between sharp or dull and soft on her skin. Okay, can you extend your arms for me? Close your eyes. How does that feel?
Soft. Soft. Dull. 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 Soft.
Okay, so she is also having and experiencing and is able to distinguish between soft and dull sensation on her arms. Now what I'm going to ask her to do is close her eyes once more and extend your hands. And I'm going to put that in your hand and you're going to tell me what that is.
Gauze.
Okay. Now the other hand.
It's the same.
Okay. So she also is able to distinguish and have good tactile on her hands. Now what I'm also going to do is ask her to close her eyes once again, and I'm going to write a letter in your hand. You're going to have to tell me what it is.
R.
Okay. Next hand. Want to make sure we check both sides.
So I'm sorry, can you do it one more time? Is it T?
Yes, it actually is T. So even though she had a little trouble, but she has good sensation, is able to distinguish between the letters. Now what I'm going to do is ask her to close her eyes once again. We want to make sure that she doesn't look. Can you lift your arms for me? Right here? Okay. So now I'm going to ask her to tell me if I position her finger up or down.
Up. Down. Up. 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 Down.
Okay, so the patient is demonstrating good sense, good positive sensation on her feet. Now what we're going to be doing is assess the lung fields. So first what I'm going to do is ask the patient to raise their shirt, and what I'm going to look at first is lung expansion. So I'm going to ask the patient to breathe in, take a deep breath in, and take a deep breath out. Can you do that for me? Okay, there seems to be symmetrical lung expansion there and a normal rise and fall. What I'm going to do now is assess for any tenderness. Let me know if you feel any tenderness.
No.
No? Okay. Now along the spinal cord, any tenderness here?
No.
Okay. So the patient is not experiencing any tenderness whatsoever. So now what I'm going to do is assess for fremitus. So I'm going to ask the patient to say 9-9.
9-9. 9-9. 9-9. 9-9.
Okay. So the patient doesn't seem to have any fremitus at the moment. So now what I'm going to do is check for their inspiration and expiration. So I'm going to be percussing. So I'm going to ask you to take a deep breath in and hold. Okay, I'm going to mark this area. Okay, now can you take a deep breath in and then take a deep breath out and hold. Okay, I'm going to mark that area. Those are the two areas for expiration and inspiration. Now what I'm going to do is take a listen to her lungs. Take a deep breath for me and breathe out. Can you say 9-9?
9-9. 9-9. 9-9. 9-9. 9-9. 9-9.
Can you say E?
E. 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 E.
Okay. Sounds like the patient has clear sounds bilaterally. No presence of wheezing or any abnormal sounds present. So now what I'm going to do is palpate the front part of her chest. So let me know if you feel any tenderness here. Okay, now I'm going to check underneath her breast. Any tenderness? Okay. So now what I'm going to do is also take a listen to her front part of her chest, her lungs here, and underneath. While looking at her, her skin looks intact with no abnormalities noted. Breathe. Okay, Now over the trachea. I'm also going to use the bell of my stethoscope. To listen for any abnormalities. Okay, now I'm going to listen underneath your voice. Her sounds sound clear, and it seems like there are no murmurs or anything present. Lastly, I'm going to listen to the 5 cardinal areas. Okay, no abnormalities were noted there as well. No thrills or extra heart sounds or gallops were noted. Okay, so now we're going to be moving on to the abdominal assessment. So what I'm going to do is, first of all, listen to her bowel sounds. I'm going to auscultate. Okay, there seems to be hyperactive bowel sounds in all 4 quadrants. Now I'm going to move on to assessing the liver. I'm going to be checking for the upper and lower border of the liver and seeing where its placement is. So I'm going to start by percussing. Okay, seems to be at the costal margin, and also I'm going to be checking now for any enlargement or any tenderness. I'm going to be palpating her abdomen. Let me know if you feel any pain.
No.
Okay. And midline as well. Any pain there? Okay. I can't palpate the spleen, which means it's not enlarged. No kidneys. Seems to be no masses or any irregularities in the abdomen. Okay. I'm going to check for a femoral pulse. Okay, seems to be present. Now we're going to move on to the part of the assessment of the lower extremities. So just starting off, I'm going to be looking at her legs and assessing them. They look even in color, no blemishes, warm to the touch, and they look equal bilaterally. I'm also going to check for pedal pulses bilaterally. She has strong pedal pulses. Look at her posterior tibial pulses. Seem good, and her popliteal pulses. Good too. I'm going to check her capillary refill. Less than 2 seconds on the left foot. Less than 2 seconds on the right foot. Seems to be good. Now what I'm going to do is I'm going to test her sensory perception. So I'm going to ask her to close her eyes. And I'm going to ask her if this is a soft or dull, a soft or sharp sensation.
It was sharp, dull, sharp, dull, sharp, 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 dull, sharp, dull.
Okay, so the patient seems to have good sensory prior perception. So now what I'm going to do is ask the patient if I can assess her reflexes. So I'm going to look at her legs and her arms. First I'm going to start off with her arms. Okay, I'm going to check her brachial. I'm going to check her brachial reflex. I'm going to ask you to just relax that arm for me. Okay, I'm going to test her radial reflex. Okay, I'm going to ask you to bring your arm out. We'll move forward a little bit and just relax that arm for me. Okay. Now I'm going to check for the same reflexes on the other arm. Just relax this arm. Okay. I'm going to check her radial reflex again. Okay. Now, same thing. Back. Okay. So she showed to have bilaterally good reflexes on both arms. Now I'm going to move down to her legs. You can just, there we go. Now I'll move the camera down. Okay, so I'm going to check her patellar reflexes bilaterally. That was a good strong one. Strong one there. Now I'm going to check posterior tibial. Okay. Okay, now I'm going to look for a Babinski sign. Okay, negative on the right foot and negative on the left foot. Okay. Okay, so on this part of the assessment, I'm going to be assessing her gait. So what I'm going to ask her to do first is to bend her knee up towards her chest, and the same thing with her left leg. Now I'm going to ask her to squat without touching anything. Okay, now what I'm going to ask her is to scoot back all the way to the back, and if she can walk in a straight line. Assessing, okay. Now if she can walk from the balls of her feet to the front. Okay, and now we're going to assess if she can walk on the heels of her feet. Okay, good. So it seems to seem that this patient has a good gait and has good normal range of motion and gait. So now what I'm going to assess is do the Romberg's test. So I'm going to ask her to do is if she can turn towards the camera, actually to the side, and I'm going to tell her to close her eyes and lift her arms up, and we have to assess to see if there's any swaying going on. In this moment, the patient is not having any swaying or moving from side to side, so she has passed the Romberg's test. It is negative. So I just want to conclude this physical assessment. Thank you so much for participating, Janelle, and thank you for watching.